Okay, it's associated with different autoimmune diseases, including chronic immunothrombocytopenic purpura. And if you have chronic ITP, they choose to, they test H. pylori infection, and if it happens that you have H. pylori infection, instead of focusing on managing chronic ITP, they just eradicate the H. pylori, and most patients they recover their platelet count, and all the symptoms are reversed without necessarily going for other procedures like splenectomy or immunoglobulin treatment or corticosteroids. And yeah, this is as I have just explained it. And normally, this is the statistics for H. pylori infection. 50% of the world population, 50% of the world population has H. pylori infection, and in New Zealand, 49% of Pacific Islanders they have it, followed by the Maori, and the least infected is the NZ Europeans, which is 13%. And this project aim was to establish if H. pylori infection reduces the platelet count in patients without chronic ITP, which is just like normal individuals like me and you. And the question is kind of like, is it like once we get chronic, H. pylori infection, does it mean that the platelet count starts to decrease or something like that? So in this project, we excluded all the patients who had other symptoms, who had other diseases or conditions which were likely to affect the platelet count. And these were patients who were coming for gastroendoscopy and who were relatively fit at MSC and here at Midumo. And we ended up not enrolling much from Midumo because most patients were relatively more sick as compared to those who were coming to Manukau Super Center. So the question here I would like was capturing information, like if somebody is bleeding or taking some medications, or so all those data will be used to kind of like exclude patients who will be bleeding or who came using kind of help, who are no longer quite independent on their own and for their own age. And we collected a specimen for our full blood count to measure the platelets. And we had a clotted sample for some serology to see whether the patient, the two types of H. pylori, there's one which is Kaga positive and another one which was Kaga negative. And the gastro team collected the biopsy, which they used for testing H. pylori infection. And this collection was not meant for this project, but we have already targeted people who were anyway going to have the biopsy taken. And those who were positive, they were treated, and we gave them about 3 months, and we followed them again to take another specimen. We wanted to see what happens after treatment and before treatment. And we also collected a stool specimen, this time to test to see if H. pylori was eradicated or not after taking medication. And statistically, these are the parameters which you compared. Platelet count for infected and non-infected people. And the patients who were infected with Kaga positive or Kaga negative strains. And we also intended to compare the pre and post eradication platelet count. And these were the platelet counts, and represented on the graph. The purple ones, forgive me of the colors, let me say the blue ones represented the ones which were not infected, and the purple ones, or reddish one or pink, those of the patients who were infected. As you see, most of them were, all of them were kind of normal, but the ones who were infected were normal, but at the closer of the minimum normal range. And whereas those from the normal and non-infected people, they were just random within the normal range, whereas the other one was squeezed towards the lower normal limit. And sorry. Sorry. Okay. Here, as you can see, this were the comparison of those who were infected and those who were non-infected. And you can see the normal ranges are a bit lower, and the ranges here are quite even higher. And here, this one had more impact. The ones which had Kaga positive strains, these two subsets were also both infected, and these were non-infected people. And statistically, those who were infected had a lower platelet count, and those who were, after eradication, we had a problem because some of the patients took some medications, but there was no eradication. Some, they didn't take medication at all, and that ended up making the subset of the infected people to be relatively too small, and it was quite difficult to deal with all those variances. And H. pylori eradication therapy, for those people whom it works well with, is quite cheap and has minimum side effects. I mean, treating chronic ITP, and this may avoid things like splenectomy or use of corticosteroids or immunoglobulin. And for this reason, I carried this experiment looking forward that probably if the same population, since our population has kind of a correlationship within the normal population, probably if such experiment could target people with chronic ITP, and if it happens that our population also have similar response, may benefit and to be quite effective, and people will not be going on ongoing treatments, corticosteroids and immunoglobulins and splenectomy and so on. Thank you.